MDs, DOs, NDs. What are the differences between these three medical professions? I'm going to try and answer that in this video here, starting with MDs. MDs, or medical doctors, are going to represent about 80% of the total physician count in the United States. And they're going to practice what is known as allopathic medicine, or what a lot of people refer to as conventional Western medicine. So you can think treating diseases after they have manifested with medications and or surgical intervention. They are going to be fully universally recognized across the world as licensed medical doctors, and so they will have full scope of practice virtually anywhere. Next, you have DOs, or doctors of osteopathic medicine. So they're going to take a bit of a more holistic approach to medicine and treating patients. And that starts with a larger focus on prevention, also more attention towards the mind-body connection, and then structural dysfunction as a component of causing various forms of health challenges and complications. So they're going to learn the OMT, or osteopathic manipulative technique, which is a bunch of different approaches to addressing structural dysfunction in the body with their hands. So, you can imagine various types of chiropractic-like adjustments and tissue manipulation, but all of that is with the intention of restoring function to the body. And so they're going to be able to pursue all of the same things that MDs are, so the same specialties and surgical specialties. The difference is it's going to be a little bit harder for them to match for the more competitive residencies, and so a larger amount of osteopaths are going to go into family medicine. And so they also are not universally recognized outside the country, because different osteopathic schools in other countries aren't as extensive as they are in the US. And so that is a bit of a distinction too. So that kind of covers MDs and DOs, and brings us to naturopathic medicine, or NDs, naturopathic doctors. So that is what I am currently in school to become. And it's sad that we're typically left out of this conversation, but that's why I'm, trying to create content like this to just spread awareness to our field of medicine and what it is, and more importantly, what it's not. And so I think it's important to start with the fact that in schooling, we learn the same things for the most part that MDs and DOs are going to learn, especially as it pertains to the core sciences. So, I've had professors now that have taught at MD schools and DO schools, and in courses like anatomy and physiology, they'll tell you that they've taught the exact same things in all of the different schools. So, that's not any different. We still have to pass board exams. So the schooling is pretty similar in terms of the foundation that we get in the human body and in disease pathology and pharmacology and all of that, right? So we still learn allopathic medicine, and we're not against it. There's a lot of contexts in which medications can be massively helpful for treating various diseases in different ways. The difference is later in our education, we are similar to DOs learning OMT. We're going to learn a bunch of alternative medicine modalities as well. So, for instance, we learn naturopathic manipulative techniques. So that's like kind of our version of OMT, where we take, various aspects of OMT and chiropractic and, tissue work and parts of, myofascial massage type work. So kind of bringing that all together. But also, of course, we learn extensively in different modalities within Eastern medicine and Chinese medicine. So different herbs and botanicals, and then acupuncture. And we also get, education in things like physical medicine and regenerative medicine, and how to leverage different types of tests that aren't traditionally taught in allopathic medical school. So that's kind of how the schooling differs. I will say an important difference is what happens after the, formal medical schooling, which is residency. So for NDs, it is optional, whereas DOs and MDs, they're going to be doing a residency to specialize in whatever that field might be is. NDs can, but don't have to go into residency. And so I think this would be one of the strongest critiques of naturopathic medicine, because I do think there is a lot of value to practicing, hands-on medicine under the guidance of experts at the craft already. So for me personally, I definitely am going to be pursuing a residency program, and I think it's a good idea for all future naturopaths to do so, but that's just my opinion there. I would say the biggest difference though for naturopathic doctors versus allopathic and osteopathic doctors is the overall philosophy of how they're approaching patients and treating patients. So for NDs, we're going to have a much more holistic and patient-centered approach to working with people who come in to see us. So that's going to start with a much more comprehensive intake, in which we're trying to really get a better full understanding of that patient's history, environmental toxin exposure, past traumas, things that could be causing whatever complaints they're bringing to us with their body, basically, or their mind. And so just trying to really focus in on individualizing that care and personalizing the medicine to that individual through a root cause lens, I think is very powerful. And personally, that's what resonated with me so much for why I chose to go into naturopathic medicine. There's a couple components built in there that are important to touch on too, I think. So one of our pillars is doctor as teacher. So educating your patients, spending real time to build a partnership with your patients. So you don't just, treat a symptom or a disease they come in, but you're able to help them optimize their health after the fact and prevent other diseases from taking place by teaching them about their body and teaching them how to take care of their body. So I think that's super cool and powerful. And I'm not, dogging on MDs or DOs, because we need great specialists. And again, DOs do have a bit of a holistic framework they're taught, but it's just more ingrained in the education, I would say, and the philosophies for naturopathic medicine. And that's not to say that there aren't DOs and MDs even that share these same philosophies. And, it's not to say there aren't NDs out there that don't live up to these, but pound for pound, I think you're going to find that way more naturopathic doctors get into medicine because they've had bad experiences with allopathic doctors, dismissing them or not taking the time to understand what's going on with them, maybe misdiagnosing them. And so that's unfortunately, had been my experience. I'd been passed around by specialist to specialist, and for 1.5 years, and my health just absolutely deteriorated and regressed. And it took, one round of testing with a functional medicine doctor who actually just listened to me and gave me tests I didn't even know existed to figure out the root cause of my issues, and then fixed me essentially with a fully naturopathic approach. There was no medications or anything. It was just a bunch of different botanicals, medical grade supplements, and lifestyle changes. And I thought that, doctors, the specialists told me that all hope was lost basically for me, and that I was probably psychosomatic at that point because all the conventional tests and blood work looked fine. But that's explained a little further in my other video and why I chose this path. And so this is, just to say that there is a difference in utility, I think, with naturopathic medicine when it comes to treating chronic and complex disease. I think the additional time and education and different forms of root causes for diseases, the education on nutritional biochemistry and different types of precision testing, as well as the personalized approach to care afterwards, it's just been shown to be more powerful for a lot of preventable chronic conditions, but also autoimmunity and cancer even. So the last thing I'll say, just because I think this is super fascinating and I love sharing this with people, but the top cancer treatment clinic in the United States is an integrative treatment center that is run by naturopathic doctors. And through using an integrative approach that blends the best of Eastern medicine with the best of Western medicine, which I emphasize that because naturopathic medicine isn't just about using a bunch of herbs and tinctures and changing your diet. It's about incorporating the best from, both Eastern and Western medicine to create the best outcomes possible for patients. Through the lens of personalizing that care and getting to the root cause. So to me, I just find that to make a lot more sense than what the conventional system does and what the medical industrial complex allows. And so that is why I chose this field. But again, if you're someone who has a strong draw to surgery or a fascination with a certain system that you just know you really want to specialize in, I think that there is, of course, really noble pursuits in DO and MD school. And there's definitely limitations to naturopathic medicine too. You're not going to have that extensive surgical training and residency and the rotations in the hospital. And I think that you probably can learn a lot in a hospital setting that you can't through doing more experience in clinical rotations in private practices or smaller centers. So, I just want to give my personal take on all of this as a person who's been bounced around the healthcare system and who has worked in the insurance side of the healthcare system, which if there's any common ground that MDs, DOs, and NDs can all agree on is that the common enemy is how the system is structured to prevent well-intentioned doctors from giving the highest level of care that they're able to give because they're going to be bogged down with a bunch of administrative crap and paperwork and be confined to insurance, driven care and treatments. So they might have a treatment that they know is best for this patient, but they can't give it because it's not covered. And so I'm definitely passionate about that too. We'll have other videos on that to come, but I'm now just kind of rambling, I think. So I'm going to wrap the video up there and just say, I hope that you found this informative and insightful. And if you made it this far, thank you so much for watching. And gonna wrap it up there. So.